Hi, Kate Collins, staff scientist here from TELUS World of Science, Edmonton. I am joined today by Dr. Steve Hrudey, who is a professor emeritus in Analytical and Environmental Toxicology at the University of Alberta. He's a local water expert who is working on a pilot program to test for coronavirus at Canada's water treatment plants. Thank you so much for joining me today, Dr. Hrudey.
You're welcome.
So to start off with, what I'm curious about is how does the coronavirus end up in our wastewater?
Well, there's been enough research done to show that the virus is actually shed in feces, and so that's what ends up in a sewer system, and it's basically collected all at one place at a wastewater treatment plant.
Okay, lovely. So what do researchers look for in the water to show that the coronavirus is present?
Well, basically the techniques, which is a similar ultimate technique as to what's used on clinical samples, is you're looking for signals from the genetic code, which is the RNA in the virus that allows it to reproduce. Fragments of that can be picked up and amplified by a technique called polymerized chain reaction. That technique is what's used to basically get signals of genetic material. It's not the actual entire virus.
Okay. So based off of that, then, does the coronavirus, does it survive in our wastewater? Is that something that we have to worry about?
Well, that's good news too. It apparently doesn't remain infective, which is obviously an important consideration for workers at a wastewater plant. First, they need to be concerned about countless other enteric pathogens that are present in wastewater. So the protective measures they take for avoiding illness from that will certainly protect them from the low risk of coronavirus. But yeah, what we're actually detecting are just these genetic fragments, which by themselves are certainly not infective.
Okay, well, that's good to know. So yeah, the idea of using the surveillance to monitor the spread of COVID-19 is really interesting. What would you say are the benefits of testing wastewater for signs of the coronavirus?
Well, we want to be clear, this is not a magic bullet. It doesn't replace clinical testing, which is what we public health officials rely on to know about who's infected. What this can do, though, is offer a very efficient strategy to sample an entire population with single samples. So a wastewater sample collected, at a wastewater plant in Edmonton or Calgary will basically represent the discharge from the entire population in that city that comes to the wastewater plant, and a single sample composited over a day would represent that population very well.
Yeah, that's interesting that we're seeing more of a community as opposed to the individual with this type of testing.
That's correct, and we're expecting that the technique can be scalable so that can be applied to large communities as well as small. And a lot of institutions have their own sewage treatment facilities, so you could also apply it to institutions like, for example, a jail.
Okay, that is really interesting. So are there any challenges that your team is facing?
Well, lots. Basically, we would ideally like to have one massive single lab that would do all of the work for all places that we wanted to sample, but there is no such lab available. They're all working full-time with clinical samples. So we're basically working with around the edges of lab capacity. So some academic labs that have the capability for this kind of analysis, and some provincial labs of public health that have people cross-appointed to universities where they can use their university lab facilities for this purpose. Trying to get everybody onto the same page to use as similar as possible methods is clearly a challenge because people have to work with what they have.
That does sound challenging, trying to get it all coordinated.
Yeah, so I mean, so far people are doing their best to listen to what others are doing and coordinate where they can, and where they can't, we'll do our best to interpret the differences.
Okay, that makes sense. So yeah, it sounds like this could be really useful to monitor for COVID-19. Is it a strategy that's new, or is it something that's been used in the past to track other infectious diseases?
It actually has been used in the past, but not very widely. Probably one of the better known examples was it's been used to evaluate vaccination programs for polio, and seeing how effective those programs have been in a population. In my own experience tracking drinking water outbreaks, there's at least a couple of examples where fortuitously people collected samples from a wastewater facility during a drinking water outbreak and were able to demonstrate elevated levels of the pathogen in the sewage. One of these was North Battleford, which happened in 2001, right after the Walkerton outbreak in 2000.
Okay. That is really interesting. So yeah, applying that knowledge to COVID-19 hopefully will help us be able to figure it out for this.
Yeah, the hope is that, obviously we've got a crisis to deal with right now, and we want to get the tools together, but there's no reason it couldn't be used for other disease outbreaks in the future, because once you have your techniques together for what works best, analyzing for a slightly different pathogen is a lesser adjustment into what you're doing.
Yeah, so it sounds like you're really working on that proof of concept. What would be needed to implement this type of surveillance system on a big grand scale? So for all of Canada, for example.
Basically, that's it. We're trying to demonstrate that what other people have demonstrated in other countries should work here as well in our hands, and we'll show those results to governments, and then they can decide whether they'd like to implement something on a bigger scale.
Okay, I imagine it would probably be quite costly.
Well, compared to what we're spending on clinical testing, it's a lot more efficient because you're processing so many fewer samples. And basically, most wastewater plants, they're regulated by environment departments. They have to collect samples for their regulatory purposes. So the sampling is already happening. It's just a matter of sharing some of that sample and doing the limited analyses. So it has the potential to give a lot of information with relatively small sample numbers.
Yeah, that's interesting. And I guess with COVID-19, one of the things that has been interesting is that lots of people seem to be either asymptomatic or don't present the same symptoms. Would that be something that would be an advantage with using the wastewater testing?
Exactly. We know that pre-symptomatic people and asymptomatic people still shed the virus. And so those people won't show up in clinical testing, but they would show up in the sewage samples. So this has the potential to give an early warning of a new outbreak in a community or a second wave, those kinds of things we're concerned about.
Okay. Yeah, no, that it would be really interesting to have that information sort of from two different sources, the population that's being tested and then also from the wastewater to help give a more complete picture.
Right.
Well, that is all the questions that I have for you. Did you have anything else you'd like to add?
No, I think that pretty much covers it. I appreciate the opportunity to share our experiences, and hopefully we'll have some results to share with people not too far down the road.
Yeah, well, thank you so much for sharing this with us today, Dr. Hrudey. Good luck getting everything up and running, and I'm really excited to hear how it all progresses.
Okay, thank you.